there are a few things that I like to go over with families during a consultation. First thing is patients ask a lot about anesthesia, and for infants below 6 months, we don't do any anesthesia for the baby. There's a few reasons for that. Number one is we don't want the infant to swallow any of the anesthetic. And the other reason is that we encourage the baby to feed afterwards. So we don't want any kind of restriction of their movement from that numbing process. We compare it to circumcision or vaccination as far as the discomfort for the baby, and we don't numb for those procedures either. So that's kind of the process for the numbing. After 6 months, we will offer a numbing cream to babies, and based on families' preferences, we may or may not use some. Yeah, here. Do you want me to just stick with the laptop?
Yeah.
Okay.
I haven't noticed that.
Okay, I'll stick with the laptop.
That's a good point.
Okay. So I tell families the first night is going to be tough. Sometimes babies are going to be really sleepy, and sometimes they're going to be really fussy, and we're not really sure which way it's going to go. But to prepare for 1 to 3 days of discomfort for the baby, and that's expected and normal. We want to have a backup feeding plan ready, just because our typical feeding process, our typical routine is going to be out the window at that point. So we want to make sure that we're prepared for other options. Stretches are important after the procedure because we want it to heal and we want to guide that healing in a certain way. We make a video with your baby on your phone so that you could reference back how to do it. We want to make sure that we have clean hands and short nails when we're doing these stretches. The wound site under the tongue is going to look like a diamond, and it's going to look like this. And so we want that diamond to heal tall and skinny instead of short and wide. And that stretching process gets that elongation that we need to guide the healing to get the best benefit. We will typically see you twice after the procedure post-operatively to check on the healing of the wound site. And it's important to understand that this is one piece of the puzzle. We don't know for sure that this is going to help this baby. We don't know for sure how the baby's going to respond. But through this process of carefully selecting who is a good candidate and providing these support providers, we have a predictable process that has helped many families. It's important to understand that there are, of course, risks, benefits, and alternatives to treating and not treating when considering any procedure. The risks of the procedure, of course, mainly include bleeding or damage to vital structures or negative effects on feeding. These are not things that we see, but can happen. The risks of not addressing tenoidal tissues are that we may see effects later in life with regards to breathing, sleeping, eating, or communicating. It's not to say that if we do a procedure that we for sure will not have any issues with those things, or to say if we don't do a procedure that we will have those issues, or vice versa. And so we can't draw a direct line there, but it's important to understand that there's a relationship. So we don't do a procedure just for preventive reasons, but we want to make sure that we understand that the tongue is important for growth and development. And we want to look at making sure that we have proper techniques for pain control. So whatever is going to be right for your family, want to make sure that you either have infant Tylenol ready. If it's after 6 months, they can have ibuprofen. If your family chooses, there are other homeopathic protocols that you can utilize as well. But the main methods that I choose for pain control are going to be skin-to-skin contact, feeding on demand, breast milk ice chips by freezing breast milk in a flat Ziploc bag you can break off a small piece and place it on the wound site so that it feels cool to the touch and it's soothing for the baby. And then of course, whatever pain control method that you choose, whether it's Tylenol or homeopathic. So those are kind of the general things that we go over that are frequently asked questions. I hope that's helpful for you when going through this process.
Love it.
There's one more consequence thought that I had. Hold on. One other important aspect when we're looking at tethered oral tissues in infants. A common question that I get is, we are bottle feeding, or we have already kind of established a path that is working for us. Should we address this tongue tie that we know is present if we have a path that's working for us? So a couple things on that topic. Of course, it's important to understand that if you have a feeding process that's working for you, of course, doing a procedure can interrupt that process. Usually that's temporary if that does happen. And so we want to make sure that we have a good reason. We want to make sure we have a functional goal in mind to justify doing a procedure. But we also want to make sure that we understand that if there is a restriction present, there are consequences. So I am so grateful that we live in a modern world and that we have many ways to feed our babies, and we want to make sure and fully support all methods of feeding for our families. However, if we have chosen a route that involves some kind of compensation, it doesn't mean that we addressed the root cause of the issue. We are doing the primary and needed goal of feeding the baby, but if we still have that root cause issue, which is an oral restriction, it may show up in other ways later. So we may start to see feeding challenges later, speech challenges later, sleep issues later. So like we mentioned, we don't do a procedure just for preventive reasons, but it's important that we understand that just because we have a feeding plan that's working for us doesn't mean that we have addressed the actual root cause of the issue.